So here we are in the last video for the unit number 2, pain. We have worked with objective number 1 to locate and describe pain, assess pain, talk about pain relief, and in this video, we're gonna learn how to communicate successfully with a patient. We know that when we have a patient in pain, it is sometimes difficult for them to express what they are feeling. On the other hand, sometimes we have had a bad day and we are not so willing to pay attention to them. But remember, treat your patient as you wish to be treated. For this, I have some suggestions for you in this slide. To put your patient at ease, it is to make her feel better or make him feel better. First of all, it is essential to have a good communication with your patient. As many questions as you ask will make you understand the pain and the treatment that can be required for this patient. The second one is try to make the patient to feel as relaxed as possible. In this case, you may keep some informal talk with your patient, like asking things like if the person is married, if they have children, if they work, or if they study. These questions will the patient forget a bit about the pain. The following one is, if possible, sit at the same level of your patient. If your patient is in pain and your patient is in bed, sit down and try to keep eye contact with your patient, but at the same level. If your patient is on a chair, sit down on a chair next to him or her so that you can keep communication with the patient and they don't feel stressed because you are there standing up, because they will have the feeling that you are pressuring them to hurry. This is really, really important. Smile and maintain eye contact. Don't forget that your patient is a human being and they require some attention that can make them feel better. For that, use a friendly tone of voice. If you are angry, relax. We all have bad days, but don't forget, this is your job and also it is your passion at the end of the day. Try to use their names in a respectful way. For example, you can say, I don't know, the name, like in my previous examples, Alma or whatever name, or you can call them by their last name, Mr. Ramirez, Miss Smith, whatever. As I was mentioning in point number 2, you can ask general questions of their lives to make them feel comfortable. Don't ask questions that may be kind of uncomfortable for your patient. And finally, if possible, tell the amount of time the assessment will take. Sometimes the patient is feeling so terrible that a couple of minutes will seem like an hour. So tell them approximately how much time it will take for you to gather some information to understand his or her pain. Having said this, here's a summary of the questions that you can use to assess pain. These are the questions that we have been working with during this unit. Some of them have some synonyms that you can find in presentations 1 and 2. So don't forget to check them in order to review this vocabulary and these questions. First, we have the question, where does it hurt? Remember, we have some other questions like, where is the pain? Where do you have the pain? When did it start? It is important to know the time when the pain started. How does the pain feel like? We have already worked with this question. What sort of pain is it? How long does the pain last? What relieves the pain and what makes it worse? So these are the questions that we have been working during this unit. So I suggest to check presentations 1 and 2 to review this. Also, here you will have a series of, this is just one interview from a nurse to a patient. I recommend you to follow the order. First 12, then 13, and finally 14. Remember that you can check this example in the presentation in Blackboard. Something important to consider about this example is that you can use it for your final oral activity. Remember that by the end of this unit, you need to record your final oral activity. And obviously, this final oral activity is related to this. So I suggest you to check these questions the synonyms of these questions in the previous presentations and check these recordings. So are you ready to practice? And with these people, we are finishing this unit. So be ready for your practice in Blackboard, your evaluation process, and the following videos for the following unit. Thank you.